stories and comment on them if you would. The first one is from a lady named Shari Hawkins who lives in Texas, and we've got a video for you to look at here.
Hi, my name's Shari Hawkins. I went in this past year for a regular hysterectomy. The doctor said that they found a tumor that was growing on my uterus. They were concerned about it. They didn't think really much of it. They thought it was a benign fibroid. And so I went in and had a hysterectomy. They took my uterus out. In the process, they chopped up that tumor and extracted it. They irrigated my abdomen, but they extracted it. They first came in and said everything's great. And then they came right back in and said, we've got bad news. They looked at the slides and they said, we took a sample of your tumor and you've got a cancer called myxoid leiomyosarcoma. So I was then sent down to the sarcoma unit, and when I saw that doctor, that was a really tough day. He gave me very bad news. He said I was stage 3 going to 4. The tumor was 15 centimeters. A mitotic rate of 10 is pretty much a death sentence. And that mitotic rate is how fast your cancer is moving and growing and spreading in your body. The slices on my tumor were 30, 50, and 70. So it was very bad. And I asked him what he could do for me. He said he was going to try the hardest chemos, very aggressive chemo, for an entire year. He basically leaned forward at one point and said, I am guessing about this treatment because the cancer is so rare. And we're just going to keep trying chemos till we find one that'll work. And I said, what is your cure rate on this cancer? Because he's actually seen this cancer. It was a very rare cancer. He kind of had a tear in his eye and he leaned forward and he said, I've never seen anybody survive it. I went into shock. The whole room was spinning. My ears were ringing. I really went into shock. And my husband, bless his heart, said, I don't feel like starting the chemo right now. Let's go pray about this. So we left. We went back to San Antonio, and that was a very dark day. To realize you basically got a death sentence and you're not going to live, and I had 3 children to raise. I wanted to live. And someone introduced us to the glyconutritional products. We were so desperate. We did our research on it. We were just excited about what it was doing for your body, so I got on them right away. Well, I took a lot. I hyperdosed on these products, and we turned down medical treatment. So we never did the chemo, we never did the radiation. I have a brother who's a doctor who did a lot of research on my particular cancer, and he called me and said, this kind of cancer doesn't respond well to chemo or radiation, so I was going to be dead if I did or dead if I didn't. And it's been since last May. This has been now a little over a year. 2 months ago, I got a complete body CT scan, and the cancer's gone. It's not there. It is gone, and I'm totally better. It's wonderful. I've got my life back. I'm a mom and a wife. I can live again. I've got a life, and I've got a lot of life to live. And I'm just so excited about what's happened and what God's done.
March to get things that have to be done before I get on the airplane to go speak. And someone said that a couple was waiting in the lobby to see me, and I went out, and here was this young mother in her early 20s and father not over 30. And one look on their faces, I knew nothing I had to do was more important than the burden on their heart. And in the next few minutes, they told me they were in death and dying support therapy for parents, that their little daughter that you see here was dying of autoimmune hemorrhagic enteritis. Most people know about autoantibodies against the joints for rheumatoid arthritis or other tissues for lupus or against the thyroid for hypothyroidism. She was making antibodies against her GI tract, and all she had was pain and bloody movements, and they were prepared for her to die. She's all bloated from high doses of prednisone, which were ineffective. They wanted to know if these supplements, and you could tell by the look in their eye and their tone of their voice, somebody had sent them and they didn't believe it because they had been given no hope. Yes. But I says, I feel confident from all our experience that this is food. We're really not even treating your daughter. We're giving her substances that the body needs, that her defense system got turned on from probably a virus or a bacterial infection, and the mechanisms that have to go through biochemically to turn it down and bring it back to rest did not work. And there's the potential that we can provide in here, these things that are missing from the modern diet, that she can run those programs in her genes to put her immune system back to sleep or rest where it should be. And they left, and I got on my plane, and I forgot her for months. And then one day, they came to my office again.
And I think we have a slide of that.
Yes. And there's that darling little girl again. And they told me that she had no symptoms, that she was off of all medications, and they say she's going to live.
Well, Dr. Reg, could you share with us exactly?
Until about 5 years ago, when I began to experience severe allergy symptoms. I would sneeze uncontrollably up to 20 times. My nose would bleed, had infections, turned into bronchitis, even strep throat. I tried treating all of this with homeopathy, with herbs, and finally I gave in and went to see an allergist. And for about a year, she treated me with some minor relief, but not to my satisfaction, and really made little effect at all. A month after that, I was in a meeting where I was sneezing uncontrollably, and a new acquaintance noticed that and offered me glyconutrients. To my amazement, within 3 hours, I had stopped sneezing. And I asked her more about it and began a regimen of taking a full array of glyconutrients. And within 3 months, all of my allergy symptoms had pretty much disappeared. And during the year that I was taking them, I only experienced 2 weeks of minor allergy symptoms. Subsequent to that, I just got kind of tired of taking product, forgot about it, and realized that I was off of them, and began to experience these allergy symptoms again. And quickly I got back on them, and to my amazement, they just started going away again. Probably for the rest of my life, I intend to take glyconutrients to make me feel better. My quality of life has improved as a result, and I think that it's doing lots of other positive things for my health.
Dr. Reg, here's a fellow who says allergies, asthma, just, boy, that's so common.
I'm very much aware how almost incapacitating hay fever or...
Just wanted to, she was a pharmaceutical sales rep, or is a pharmaceutical sales rep, and wanted to do a little preventative maintenance, if you will. Let's take a look and see what she says.
Hi, my name is Pam Redmon, and I was introduced to Glyconutritionals from a friend who was battling cancer. And as I looked at that information, I was pretty blown away, because I've been in the pharmaceutical industry for 15 years. And I was just very impressed with the science behind it and the continuing education courses that are presented to physicians. And so I thought I would look into it a little bit more. I considered myself very healthy, so I didn't think I really needed them, but I started developing some female issues, PMS. I don't need to name the symptoms involved there, but I also started developing some other problems that was inhibiting my lifestyle. And so I went to the doctor to get a checkup, and basically did a pelvic ultrasound. And I was informed that I had fibroids and cysts and all kinds of things like that. And she basically told me I needed to get on the birth control pill to regulate my hormones. I literally thought I was going through menopause or something. I didn't know what was going on. And so I started on the glyconutritional products, including the phytosterols. And after I would say about a month and a half, I noticed a complete change. I was regular again. I felt different. I fell asleep on my own, which I had always kind of had trouble with that. My PMS went totally away, and I was amazed. So I started telling everybody about it, and as well as when I would get my hair cut, my hairdresser would point out, "Gosh, what are you doing? Your hair is just growing in spurts all over the place." And people would even come over and look at my scalp, and it was just growing in all around my face. And so I was very thrilled with that, because I'd complained over the years, since in my 20s, that my hair was basically falling out and getting thinner, and I didn't know why. And so here, this product was not only making my hair grow back, it was much thicker, and all this happened within the first couple of months. Well, over time, I started noticing things like I had developed arthritis in one of my fingers, and I kept a watch on it, and I would check it out from time to time, and gradually it went away. It took about 7 months probably. But also I had bursitis in my hip that when I worked out, I noticed that I would limp, or when I'd sit too long, I'd get up and I would be very stiff and it would hurt. Well, that's also gone away. As well as I had, thought I was healthy, but I had a condition also called plantar fasciitis, and I don't know if a lot of you know what that is, but basically it's a very painful foot problem. And that is also gone. I just noticed that recently after about 8 months of being on the product. So I had a lot, here I was a healthy person, but my lifestyle was inhibited because of some of these issues. And therefore, I decided, you know, I'm going to use these products as basically like an insurance policy to prevent cancer, to get rid of these little ailments that people tend to just want to live with. I didn't want to live with them. So I look forward to seeing what else is going to change in my life, and I just want to be the picture of health. So I'm staying on them the rest of my life.
Well, Dr. Reg, here, a person healthy, they start taking them and it begins to affect them in all areas of their life.
Isn't it amazing that all the cells of the body respond to improved nutrition?
Yes.
Now, some of the things that you were seeing there, I'd like to make a point that we have had this type of thing happen repeatedly in studies, because in this, a counselor reports on 21 families with children with autism. And not only do they have improvement in their autism, but they have a grid here, a box of side effects. And shall we say, if she took those products to make her hair thicker, or I think it was to prevent cancer in a cancer family, yes. And she tells you all these things. Well, in these children, there was a 64% relief of allergies as a side effect. Asthma, 100% relief of symptoms. Ear infections, 40%, sinus problems, 67%, rashes and skin problems, 83% clearance, chronic diarrhea, 100%, chronic constipation, 90%. I sit here proud of these side effects, like you just got through hearing from that beautiful young lady that has been selling pharmaceuticals for 15 years.
Well, there you go, thinking outside the box again. Well, Dr. Reg, we've got just a couple of more studies or situations that I'd like for us to take a look at. Tell us about this young child.
Well, this is Bianca from Canada, and she was born with a gene defect called Sturge-Weber syndrome. The distribution of the facial nerve, they're abnormal capillary blood vessels. As you look at that, you can imagine the difficulties this little girl could have trying to go to grade school and beyond. But I was contacted by her mother because she was desperate. Bianca was having about 10 seizures an hour, 24 hours a day, and she wanted to know if this could help, and I said, well, we have heard of other children and adults with seizures when nothing has worked, that the phytochemicals and the glyconutrients have been of help. She was calling 2 and 3 times a day, and about the third day I found out I was in the middle of a major conflict. And they had set a date in a few weeks to remove the left side of Bianca's brain to stop these seizures.
Oh my goodness.
And in about a month, the father took Bianca to the hospital, and then her neurosurgeon refused to do the operation. He said, we don't do this for children that are having 1 seizure a day.
My goodness.
And that's where we'd gotten her. Recently, I got a follow-up that she's gone now 3 years without a seizure. But in those pictures, we have, not only is she taking it internally, but we have it in topical gel. And she's had laser treatments, and instead of getting scarring and puckering and distortion of the skin, she has gotten and continues to get an incredibly good cosmetic effect. But even better than that, I am told that they have never had a Sturge-Weber syndrome child develop intellectually, coordination-wise, socially, as Bianca has developed.
Children seem to be your heart, and we've got a little girl, Lindsay. Tell us about this little girl. That just breaks my heart.
Well, she had, again, I had made mention of the children with the rashes and all. Our skin is one of our biggest, if not the biggest organ, one of the biggest organs in our body, and it's very complex, and it's a layer of defense. And most of us know certain chemicals can cause allergies and hypersensitivities and blisters and infections. And she had a skin condition that medicine has a hard time dealing with, and that you get irritation and fluid, then you get secondary infection. And her ability to go to school and be in public was, because this was all over her body and her arms,
yes.
and she may have had a degree of atopy, which is a complex allergy responding to almost anything that you get itching, redness, scratching, weeping, and then infections. So in the wonder of wonders, by improving her diet, what is out of balance that causes the original triggering of the irritation of the skin followed by the infections? The next photograph shows you on the right there, her back in the whirl, feeling good about herself, enjoying life, and also we have pictures of her arms and back that before were just like the worst places on her left forehead there, and it's all gone.
Well, she had this condition, Dr. Reg, for 10 years, and it's my understanding...
This woman was born with a little red place under the chin. At birth, it just looked like something that would go away, and when the parents were concerned about it, my understanding, they were told, oh, that'll go away, but it didn't go away. And it became a lymphangioma that began to spread. If you were to look at it under the microscope, it would be distended lymphatics and capillaries, and you can see this huge mass from one ear to the other, and this continued to the point that it doesn't show there very well. They had to do a tracheostomy because it was occluding and compressing the trachea. They tried on camera all the drugs that you give for malignancy, and nothing did any good. Then I guess someone somewhere heard of the crazy doctor from Texas going through saying, try this, it works, it's food, won't hurt you, it's what your body was designed for. The science of this is to open your mouth and swallow. In 21 days, after adding the missing nutrients on the left, you see that combined with her therapy that was not working, looks like a normal child.
Yes. Yes.
Now we have the report that a lot of times when you have to have a tracheostomy like this in a child like this, you get a lot of problems from the stenosis and scarring of the tracheal invasion there. But my understanding is that all of this is reversed and has stayed reversed, and it would have been a tragic thing if they would had to have gone in surgically, because most people are aware that women that have a breast surgery, extensive, sometimes they get lymphedema of the right arm, and their arm gets so heavy and big that they can hardly move it because the fluids cannot get back and travel to the right side of the heart and get back into the serum phase. And to surgically go in the neck in here, it could easily, the upper half of the head become edematous like this, and it's marvelous that you could avoid surgery trying to remove this excess tissue. And to me, it's amazing that by giving the cells what they need for control of growth and development, that it can go back to normal.
Yes, in 21 days.
21.
Diabetes is at epic proportion in this country today. And I'd like for us to look at the monitor. We have a man by the name of Bob Stovall who has enjoyed wonderful benefits from these glyconutrients.
I was fortunate to have a Bachelor of Science in biology and math, and the theory of glyconutrients made a lot of sense to me. I'm a firm believer that if you give the body the right support, it is designed that the body will heal itself. In October of 2003, I literally thought I was fixing to be going into a wheelchair because my diabetic neuropathy had progressed to the point where I would literally count steps before I would go do something. I would outline what I was going to do. I would make sure that I had everything I needed so I didn't have to make any extra steps, because I was in that much pain. Could not wear shoes. If I wanted to get into my car, I'd wear my shoes to my car, take them off, and I would drive with cruise control. I really couldn't even drive the car with my feet. My hands, if I wanted to stretch my fingers out like that, I would literally cry. My hands were like this. I could not pick anything up. So anyway, I was visiting with this young lady that got me involved with the glyconutrients as far as taking them. Started taking it on a regular basis, and literally within 7 days my feet had improved 80%. My hands, I would say, improved about 95%. Almost all the pain or discomfort was gone from my hands. I could walk, did not have near the pain, still was very uncomfortable, but it improved so much it was like a new life to me. I could wear shoes again, and started taking the product real regular from that point on. Did not degress any. When I was going through my diabetic neuropathy, besides my feet, my hands, if I wanted to pick an object up, because my hands were like this, and I would have to go past it, pick it up, and then come back. Could not reach out and grab something. Could not fully extend my hands. They were like this most of the time or all the time. And my feet improved about 75 to 80% of that 20% that was left. Since then, I've stayed on the product on a real regular basis. It allows me, I work 50 hours a week, very active. I go sailing at least 40, 45 weeks out of the year. Try to go at least 1 to 2 days a week. It was literally terrifying to me to think that I was going into a wheelchair and give up my lifestyle. And glyconutrients have changed my life. They worked. I'll be on them for the rest of my life as far as I'm concerned.
We've had so many people with heart damage, kidney damage, damage to the retina from diabetes, damage to the kidneys from diabetes that have had major return and loss function.